You said you had a crazy labor and delivery story.
Usually the crazy labor and delivery stories are castor oil. So this is another thing to never do. Castor oil, gals will use it when they're desperate to get into labor. And it works, but it's not worth it. It's like major intestinal cramps, like super dehydrated. They're contracting like crazy, in horrible pain. Anyways, I've had a few of those patients, but the worst one I had was when I was working in Washington. It was this gal that was like 37 weeks. So 40 weeks is full term. 37, they consider it term technically, but really the best time to have a baby is like past 38 and 5, 39 weeks, just when the lungs are the best for the baby. And it's a young mom, first time mom. I swear she was like 19 or 20. So she comes in contracting a little bit. I have her as a labor check. What we do with labor checks is like watch them on the monitor to see how often they're contracting, check the cervix, keep them for a couple hours. If the cervix change and the contractions are regular, then they're in labor, and if it doesn't, then they're not. So hers, cervix didn't change, the contractions are pretty sporadic, so I have to send her home because she's not in labor yet. And I was like, it's okay, another week or two, hold on, I know you're uncomfortable, but really the best thing for your baby is if you buy another week for the lung maturity. And I remember her looking at me like just angry. Yeah, she's mad that we're sending her, didn't want to be there. So she comes back in by the end of my shift, probably like last 3 hours. Thinks she's in labor again, and as they often do, go home and take castor oil. She's in the bathroom continuously, like messes everywhere. It didn't go well because she's so dehydrated. Probably took too much of a dose that the baby's heart tones are starting to drop. Yeah, it was scary. And so she ends up in the OR on a C-section. And
Jeez.
Yeah.
Fluids and all that.
Right, and when you're the labor and delivery nurse, you're also the circulating OR nurse that would follow the, so I did a lot of OR deliveries. But anyway, so we're in the OR, and it was the worst situation. I think she took the most castor oil of anybody I've seen, but she's literally messing herself all over our OR table, down on the ground while delivering. The delivery went smoothly, but the baby wasn't breathing very well after because it's too young, 37 weeks.
Yeah.
Didn't get that lung maturity. So the baby goes to NICU, yeah, and then I've got a mess to clean up in the OR after.
You clean that up?
Well, no, I mean the housekeeping comes in later, but I'm cleaning up the patient. Yeah. Anyway.
I bet that was a pleasant smell.
No, it's
birth
awful.
kind of has a weird smell in and of itself.
Yeah, you get used to it. Yeah.
Like, all those smells you kind of get used to in the hospital. Like, The only one I could never get used to was like, we were on the gastrointestinal floor, was like C. diff.
C. diff is the worst smell if you smell it.
GI bleed.
That's even worse, maybe. Yeah.
That one's probably worse than the
Yeah.
But yeah, you kind of get used to those smells, like the perineum.
You do, yeah. You can't gross out an L&D nurse or a gastro nurse. Yeah, like we smell the worst things.
Were you able to keep the stool from? You're trying to be sterile on the belly.
Yeah, fortunately, I mean, she's on the OR table. I've already got her, like, urinary cath, so it's just going down. But, yeah, I didn't mess with the surgical site. Yeah.
Oh, my gosh.
Fortunately, I've got the surgical booties on and stuff. But, yeah, it was a mess. So, yeah. Anybody listening, never use the castor oil. It's not worth it for anybody involved. Yeah.